Hello and Namaste. I am Dr. Chandrasekhar from Visakhapatnam. I want to share a remedy. The remedy is widely used in household, tubercullinum. Tubercullinum is prepared from the pathogenic bacteria of the lungs, coach lungs. It is a deep-acting remedy like silicea and sulfur. When well-selected remedies do not acting well, the patient constitution is breaking down due to deep-seated pathology. Tuberculum is the remedy. Can anyone give the tuberculum without a family history of tuberculosis? Yes, we can give the tuberculum without a family history or in their past history of the patient. When the constitutional symptoms agree, the symptoms like narrow chested, emaciated, low immunity, no appetite, frequent health issues, that means frequently the patient is falling to sick, susceptible to weather changes, chilly patient, rapid metabolism, perspiration at night, grinding of teeth. These are the some constitutional points of tuberculum. Let us discuss some mental symptoms of tuberculum. The tuberculum patients are anger, aggressive, abusive, capricious, capriciousness. They don't know what he wants, like Sina and Camomilla. They are dull or mild. On the other pole, they are very destructive. Destructive means if we give any toy to child, the child breaks it, destroys it. The children are often forgets. Forgetfulness is the another mental symptom. They are high spirited, shaking, tormenting children, unmanageable children. The parents cannot manage them. Often we see the children come to our clinic are very hyperactive. They run here, they run there, they jump, they don't listen the orders of mother and father. Such type of mental symptoms we can find in every veterinary medica. The fear about dogs has mentioned, but Dr. George Vitarkas has mentioned this is not only have a fear of dogs, it has a fear of cats also. The patients are sensitive to see them even. Often the mothers bring the children to our clinics like such symptoms. The child often getting sick, frequently falling to sick, like he is getting frequent fever, frequent throat infections, frequent tonsillitis, frequent cold, frequent allergies, no appetite, and low immunity. In such cases, we often give tuberculum as a remedy or a intercurrent remedy. And if we see the affinity of tuberculum, the affinity of tuberculum is throat and upper respiratory tract infection. Throat means sore throat, tonsillitis. Upper respiratory tract means it is useful up to apex of the lungs, especially left side, left apex of the lungs. Bacterial infection of the lungs. Swelling of the cervical glands. Swelling of the inguinal glands. And the main affinity of this remedy is bends of the joints, elbow and back of the knee. In the throat affections, the dry hawking cough is one of the frequent ailment we see in our daily practice. Dr. William Borick said the tuberculum is the remedy for renal affections. That means it can be think when the patients are suffering with kidney failure or chronic kidney diseases, etc. Dr. E.B. Nash has mentioned in his veterinary medical as a first line as cosmopolitan. Tuberculum is a cosmopolitan. He wants to go from one place to another place. His disease also goes from one place to another place. Dr. George Vithoulkas has mentioned as the tuberculum is a pathologically cosmopolitan. Dr. H.C. Allen has mentioned the tuberculum symptoms are ever changing. The disease goes from one organ to another organ, like brain, lungs, liver, stomach, intestines, later nervous system. The changeability is the main symptom of tuberculum. Let us discuss some diseases and diversions of tuberculum. The tuberculum patients likes tasty food, delicacies, ice cream, sweets, salty food, cold milk. They desire cold milk, but aversion to meat. The tuberculum patients often feel exhilarated at mountain areas, aggravated at seashore, and aggravated at wet, cold weather, and emulated at dry, warm weather. Tuberculum can be used in many complaints, like in periodical sick headaches, intermittent fevers, in case of children, ADHD, attention deficit hyperactive disorder, hyperactivity issues, behavioral issues, and in case of females, dysmenorrhea, retarded menses, and menses irregularities. The tuberculum are highly metabolic, but they are chilly. The high metabolism and emaciation we find in iodine. Iodine is hot, but tuberculum is chilly. The tuberculum looks like phosphorus, calcareous. Dr. Kent has given a warning while administering the tuberculum. When any patient or any child has cardiac affections like congenital heart disease or atrial septal disease, if we detect in them, don't give high potencies. Otherwise, tuberculum can be given in 10 m, 50 m, or cm, but infrequently. Thank you.